Hello, and thank you for joining us today for this webinar on the Skilled Nursing Facility 5-Claim Probe Review Sample Findings. And this is for this quarter of January through March of 2025, so second quarter. My name is Mary Sue Gardner. I'm a registered nurse in the Provider Outreach and Education Department, and I'm joined today by Jennifer, who is also a nurse on the Provider Outreach and Education Department, who's going to be helping with the chat and the Q&A portion of today's call. A few housekeeping items before we get started. On our website, wpsgha.com, we have a training center link at the top of the page. In our training center, you'll find all things education, such as training materials like the slide deck, any upcoming educational events that we're going to be hosting, as well as the encore presentations, which are the recording of our live presentations that you can watch outside of YouTube. Now, those encore presentations are on our encore page on our website for about 60 to 90 days, but they're always available on our YouTube page until the information is either updated or changed or, just taken off. If you have questions during today's event, you can place those questions into the chat and send them to all panelists. Finally, if you have any feedback about your experience today, there's going to be opportunity during and after the event to take the survey. Jennifer's going to place a copy of the survey link into the chat now and also into the chat at the end of the presentation. So if you find you have to leave the presentation early, go ahead and use the chat link that's in the, use the survey link that's in the chat. If you're listening to this as an encore, we also encourage you to take the survey during the encore. The encore survey link should be in the top right corner of the screen. It'll be a little eye with a circle around it. It's also available at the end of the presentation, but you can always find it in the description of the encore as well from the YouTube. This is just our disclaimer on the screen. So basically it says, we prepared this information as a tool to assist our provider community, but keep in mind Medicare laws, rules, and regulations often change. And it's your responsibility as a provider of Medicare services to make sure you're following the most current laws, rules, and regulations that are in place on the day of service that you are providing those services to your Medicare beneficiary. CMS always has the final coverage determination. All right, acronyms. Medicare's full of acronyms. These are just some acronyms I may or may not say during the course of this presentation that are relevant to skilled nursing facility. So if I happen to use an acronym and you don't know what it is, just refer back to this. And if it's not on here and I throw out an acronym, because I tend to do that a lot, go ahead and just put it in the chat if you don't know what it is, and Jennifer will send you the answer. All right, why are we here today? My objective for today is that you, our provider community or SNF provider community, learn about the common review findings in the Skilled Nursing Facility 5-Claim Sample Reviews that we have been doing on all of our skilled nursing facilities. But really, I want you to learn today, how do you avoid these issues in your own facility? We're going to achieve this today by discussing where we are in the review process, give you some data, some background. We're going to review the most common errors in each of our jurisdiction, and we're going to talk about some tips to avoid these errors. All right, so our reviews continue. If you've been listening along to these events, then you already know that CMS ordered all MACs review every skilled nursing facility in their jurisdictions in an effort to lower that skilled nursing facility improper payment rate. So starting back in 2022, contractor actually projected an improper error rate of 15.1% in our skilled nursing facilities. And again, this was across the board for all of the United States. Now, this was up from 7.79% in 2021. So what may have caused such a shift in the projected improper payment rate? The theory is that the SNF payment model changed from the RUG-4 to PDPM for the dates of service on or after October 1st of 2019. So right before we entered a global pandemic. So in an effort to make sure providers are understanding how to gather and document information into and for the PDPM, we were tasked with reviewing a small sample of claims, so 5 claims from each and every provider, and providing education on those findings. So if you have not been sampled yet, and I suspect almost all of our skilled nursing facilities have gotten a letter or gotten notification that their sample has started. But if you haven't been sampled yet, what can you expect? You're going to get a call. You're going to get a contact by someone here at WPS. They're going to establish a point of contact with you. They're also going to send a notification letter that you're going to be under review. Then they're going to tell you that we're going to sample a selection of claims. That's 5 claims that we're going to select. And those will be prepaid claims before they go through and process to the payment floor. We're going to let you know the results of those individual findings, and then you are going to be offered widespread or one-to-one education. I highly encourage you to take the education, the one-to-one education, learn about your errors. Even if there's one claim in error, it's going to benefit you to learn about what caused that error. So let's dive into some of the data as to where we are thus far. We're really in the home stretch now. Our reviews will be completed by the end of June. All of our final reports will be delivered to CMS, and some individual education may continue after June 30th based on when your sample is complete, you know, in that time frame, and when you have time to schedule it. So let's look at where we are thus far in the review process of all the SNFs. In J5, there are 2,447 skilled nursing facility providers. Of them, we have sampled 2,138. So they have been reviewed and completed thus far. That's 92% of the total of skilled nursing facilities in J5. So during this quarter, we closed out 563 providers by completing their 5-claim sample. Thus far in J5, 111 providers were excluded from the review process. And someone is excluded, or a facility is excluded, for a few reasons. Maybe because they either have just come off like a targeted probe and educate review, or they may be under another review by another entity like the Zone Program Integrity Contractor who covers fraud, waste, and abuse. So those are just a couple of reasons why a provider may be excluded. Moving on to J8, we have 560 total SNF providers in the J8 jurisdiction. Thus far, we've reviewed 491 of them, so 94% of that total. In the last quarter, 105 providers were reviewed and completed and closed. For J8, 35 providers have been excluded from this process. So what's the data looking like for providers who have finished their reviews? How many errors are providers seeing? On the left-hand side of the screen, let's look at those 563 J5 providers that were closed last quarter. Starting with 0 errors, 84 providers closed with no issues identified. So that's 14.92% of the total we looked at. We move on to 1 error, which was 118 providers, or 20.96%. Now remember, 1 error out of 5 already brings you down to an 80% if we're thinking about passing rates. As we move on to 2, with 134 providers closing their review with 2 errors, that was 23.80%. We have to remember this brings the passing rate down to 60%. So in hindsight, well below an average pass-fail percentage. Move on, 100 providers closed with 3 errors, so 17.67. And that is a 40%. And again, the 4 and 5 errors, and you can see the number of providers here that those equate to as well. So 54 with 4 errors and 73 with 5. As we move on to J8, we had 105 provider reviews closed last quarter. 21 of those 105 closed with 0 errors. So that's 20% of all of our J8 providers reviewed last quarter. 26 closed with 1, so that's 24% of the total. That was the highest in J8. Again, 1 error is an 80%. So moving on to 2 errors, we had 23 providers closed with 2 errors, which was 21.9%. But remember, 2 out of 5 brings you down to a 60. Then the rest, as you can see, were 15 with 3 errors, 4 with 5 errors, and 5 with 5 errors. 5 with 4 errors, 15 with 5 errors. Whew, tongue-tied. Now remember, at the end of the review process, education is offered to every provider, and we highly encourage you to take that. If you are found to not have errors, that is wonderful, and education like this is great to, stay in touch with how can we continue to avoid that. But if you even had 1 error, really take the steps necessary to take the education so you can fix any issues that are identified by those reviewers. Now, keep in mind, providers that had 5 claims out of 5 fail will probably go to the targeted probe and educate review process starting next quarter, because at this point your error rate puts you as an at-risk provider to the Medicare Trust Fund. We need to review a larger sample and have a tiered claim review to examine your documentation, to look at your billing, to see if you are providing services in accordance with the Medicare laws, rules, and regulations. As with most quarters, you'll see that the top 5 errors for each jurisdiction are pretty similar in ranking. The first 2 denial reasons between J5 and J8 are exactly the same for both jurisdictions. Then they waver a little bit as we get into the ranking of those. But we're going to move on to these actual errors. We're going to talk about them. We're going to show you what the denial reason says, and we're going to give you information about what this means in layman's terms. On this slide is the first CMS reason code for denial. That's the same in J5 and J8. So the SN600. On Each of these slides, we have the official wording for the CMS reason code, then we have the AKA, or otherwise known as, information. So basically, the AKA information is the layman terminology about this. So the first most common error, again, the SN600. It's defined as documentation submitted does not support the level of service as shown on the claim. The HIPS code was recoded to reflect the MDS changes supported by the documentation submitted. So in layman's terms, this means the documentation and the bill to Medicare didn't match. And based on what we found in your documentation, we had to redo the MDS based on what the documentation did support. And we recoded the claim to pay it at the corrected HIPS amount. Now for the important information. How do you avoid this error? You do that by ensuring that your documentation matches the HIPS code of your MDS. If it's not supported in the documentation, then was it done? We can't say that it was. So we have to pay you at what we can assure is done. So again, we'll pay you at the rate that matches what's in your documentation. Moving on, the SN602. So that's the next in the overall ranking, and this is the second highest in both J5 and J8. It's defined as the HIPS was recoded to reflect the HIPS code generated by the MDS found in the repository and supported in the documentation. So in other words, if you see this reason code, it means that your HIPS code that you billed to Medicare and what you locked in the MDS repository don't match. And so we recoded your claim to be what it was locked in the repository because that's the one that was supported by the documentation. So for this one, it's pretty simple. Just make sure whatever is locked into the repository for the MDS HIPS code is supported by your documentation, and it's also the same HIPS code that you billed Medicare. If you feel there was a mistake in your MDS, you should validate and recomplete the MDS before locking it into the repository. All right. So the SN300 is ranked 4th highest in J5, 3rd highest in J8. This denial is for lack of certification and recertification. This information was usually just missing. This is a very easy denial to avoid. Just submit the required certification and recertification. There's no AKA on this one because it's pretty self-explanatory. Your patient must be under the care of a physician or NPP if allowable in your state, and that physician or NPP must certify the reason for the SNF stay or the continued reason for the continued stay for that patient to be in your facility and receive continued care. Just as a reminder, certification is due upon admission or as soon thereafter as is reasonable and practicable. The first recertification must be made no later than the 14th day of the inpatient extended care services. Then your subsequent recertifications are to follow at intervals no later than 30 days from the last signed certification. Remember, all of this can be done before the timing, but not after. And remember, to avoid this error, get your certification and required recertifications in your documentation and submit those if you are requested for review. If we cannot verify the patient was certified for care by a physician or non-physician practitioner while in your facility, we can deny those services. Even if your certification timeframes are off, we can deny a portion of your services too. So remember, it is important that you get your certifications and you're getting your required recertifications appropriately and in the correct time frames. And the last thing I'm really going to hone on about certifications and recertifications is watch the dates. Remember that the time frame is from the date of the last signature. So whenever the physician or non-physician practitioner signs on your recertifications, then those 30-day recertifications are 30 days from that signature date. So if you give a reminder date for that physician or non-physician practitioner as whatever date, the 28th of that month, and that practitioner came in on the 26th of that month and did the recertifications, then your next one is due 30 days from the 26th. If you've already pre-populated in a number based on when that patient was admitted and that physician or non-physician practitioner doesn't come in on those exact dates or sign it on those exact dates, you could be making your facility out of compliance with signature requirements. So, I do encourage you to pay attention to that. All right, moving on. The SN 700 was the fifth highest in J5, but, 6th, I believe, in fifth highest in J5. No, I am wrong. I have to go back and look. But this comes down to, overall ranked the third highest. So this error is basically insufficient documentation. We just didn't get all of what we needed, or all of the components weren't clearly documented. So we don't have enough documentation to support the service as billed. Lack of documentation most of the time includes missing look-back information or missing evaluations. For instance, we may have therapy notes for the dates of service that we requested to review, but we don't have the therapy initial evaluation to see where it all started. So look-back information and initial evals are the most common information that is forgotten or insufficient. Generally, this leads to, again, missing look-back information. Remember, the way that SNFs get paid is based on the information gathered before the dates of service. That's why it's of utmost importance that you get us that look-back information. And again, the easy thing, to avoid this issue, just make sure you submit everything that supports your dates of service billed, include all that look-back information, include all of those initial evaluations, make sure reports are complete. Make sure documentation is signed and dated, and ensure that you're always submitting, again, that look-back information. And it may just be easiest and best to submit the entire record. That way you can ensure you have everything covered, including the look-back documentation. So the next highest in ranking overall is the SN 302. And this one is the documentation submitted did not include the required recertification for skilled nursing facility stay. So otherwise known as timing of recertifications, remember, includes by the 14th day of the stay, then subsequent at intervals not exceeding 30 days. Remember, intervals can be shorter but not longer. So to avoid this issue, it's the timing thing. Again, in a lot of cases, make sure that it's being completed timely. That first one, by the 14th day is, you know, hard and fast. So that's got to be done before the 14th day. The subsequent, not exceeding 30 days. And you can refer to the eligibility and entitlement manual regarding that, Chapter 4, Section 40.0. And that's the Internet Only 100-01. All right. And then the next highest is the GAN01. And this is for no documentation received. And it floors me that this still continues to come about. This is a pretty silly denial reason for me, because we've done so much education on alerting our providers about these 5 claim sample reviews that everyone should have their billers on high alert to see if the claim has moved in the system. So it moves into a status location of SB 6000, and then the very next day goes into SB 6001. And that should alert your providers that that claim has generated an additional documentation request or an ADR request. And you only have 45 days from the date of that ADR request to gather your documentation and get it submitted. So for this one, if you are in a Part A billing system and the documentation never got submitted for review, you're going to then see this claim move into a status location of 56900 or 56900 denial, which means nothing was submitted in that 45-day time frame after the ADR was issued. You cannot appeal a no documentation received denial. There's nothing to appeal because there was not a medical review decision made. In order to possibly correct this, you would need to submit for a clerical error reopening. And you can find information about the clerical error reopening and the form to use to submit it on the Part A portion of our website. So J5A, J8A, you would go into forms and claim correction. There's several more tips noted on this slide to avoid the issue. The first being, make sure you are responding appropriately in the time frame noted. So again, if your biller happens to see this claim move into the ADR status location, they should immediately be notifying the facility to ensure that they know that this claim is under review and someone's going to need to start gathering the documentation to submit. Because your ADR letters may be going to a corporate site and they may not be going directly to the facility. So you're going to want to make sure as a skilled nursing facility, you have a plan in place to watch for reviews. And you've also, once you go on a review, you've been alerted, notifications gone to your facility, so you should have someone that's watching for these reviews to come about. All right, so that is all on the documentation, or all on the errors. I'm just going to quickly run through the documentation guidance. So when we request a review, these next couple claims have documentation requirements for Part A SNF services. Remember, it's of utmost importance that you send all of these different components of documentation when we request them from you. So we're going to need acute care discharge summary and transfer records. That's really going to support part of your look back information. Your admission records, including diagnoses, conditions that require skilled nursing facility care. So why are they coming to your facility? We're going to need your physician orders. We're going to need physician, non-physician practitioner progress notes. Nursing, everything you document on, we pretty much need all of it. So any flow sheets, any treatment records, any progress notes, any medication administration records, If you are keeping nutritional records or if dietary is keeping nutritional records, we need those as well. Social services, case management, if they are involved in your patient, we need their information as well. As we move on with documentation from possibly other departments, ADLs, this usually comes down to information from the nursing staff, but when we start talking about PT, OT, and SLP, you need to submit their documentation as well. Especially some facilities have private entities that do the rehabilitation care. So if your beneficiary, if they come up as someone that we want to review, you have to get all the information from your therapy services, be that PT, OT, or speech language pathology. So that includes all their evaluations, their plan of care, their progress notes, their treatment notes, and the actual treatment time is supported in minutes. And then it just goes on. Physician certification, we beat that horse to death pretty much. Any plans of care by any people that are treating your patient, any diagnostic records, and any MDSs as well. And then finally, before we go to the open question and answer portion of today's call, I want to stop and just talk about the skilled nursing facility revalidations for provider enrollment. This is a reminder to all of our skilled nursing facilities, and please, 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 I don't care if you're a biller, a clinician, whatever, please pass this information along to your administrators. In October 2024, all MACs begin sending off-cycle revalidation requests for provider enrollment to all enrolled skilled nursing facilities due to reporting changes on the CMS 855A enrollment application. May 1st, 2025 is the submission deadline, and it is quickly approaching. To avoid interruptions in your Medicare payment, we have to get you recertified. So MACs must receive your, or revalidated. MACs must receive your SNF revalidation application by May 1st. If you have not sent your SNF revalidation and you have questions, consider attending our April 14th. So just next week, we have an event again on SNF revalidation questions and answers. So if you're having issues with that, sign up for that event next week. And Leanne is going to walk you through everything you need to do, everything you need to know about that, and answer all of your questions. I'm going to have Jennifer put a link to that event, our live event page, not the event, but our live event page back into the chat in case you happen to miss it. And then that way, if you wanted to use that link and go out and enroll for that, you can. Remember, the most important takeaway, failure to comply with this by this May 1st date will cause disruptions in your Medicare payment. So I would hate for that to happen. There are a couple additional resources on the bottom of this page that you can go out and read about and learn some more information if you find you can't attend our event next week. All right, and then finally, these are just some resources for you to get a little bit more information about skilled nursing facility services. Hopefully you know these, but I just wanted to provide them for you. So let's recap. It was an action-packed day. We went over those common review findings. We went over where we are in the review process. We reviewed the most common errors in each jurisdiction. We even went over some tips or AKA to avoid these issues. And we did this in an effort to help you learn about these 5 claim sample reviews and avoid any findings in the future. Now, before we go to the questions in the chat, we did have one pre-submitted question I wanted to address, and it says, what is the best reference to cite when an MA plan denies something per their policy? However, there is an established NCD and it meets the criteria for coverage for payment. And the answer to this is, unfortunately, we can't advise on MA plans and their policies. However, they should have a process in place for reconsideration or appeals, if you will, of your denial. I would strongly suggest that you also reference their policy in your reconsideration request to them and where your documentation supports their policy standards. There's information also on CMS's website on grievances if you have an issue with the managed care's operations. So there is, or this is outside of like their actual claim determination. So if you just have a problem with the things that they are doing, you don't think it's right. And Jennifer actually put some information into the chat on how you can find that. And then 2 more things. I wanted to take a few minutes and tell you about some errors that have been coming up in our other reviews, like targeted probe and educate and cert contractor reviews. And we actually talked about these in the event, but the issues are being found in these other reviews, so we really want to hone in on them. And those are issues with certification and recertification errors, and the timing not being correct or not containing the proper information on what the physician or non-physician practitioner is recertifying for. I am actually hosting an event on May 20th just on skilled nursing facility certifications and recertifications. It should be posted to our website in the next several days. So do go out to the live event section of our website in the next couple of days and look for that. And then the next issue again is the no documentation received issue. And again, this is becoming very prominent and very relevant to our skilled nursing facility providers. Remember to have someone in your facility looking for those additional documentation requests and acting on those within the 45-day time frame. And if stuff is going to a billing company, that billing company should have an agreement with you to contact you at the facility level if something moves into this kind of status location. If the hard copy letters are going to a corporate headquarters, make sure somebody knows at the corporate headquarters to forward those on to the facility so you can gather your documentation and submit it for review. So at this time, I'm going to ask Jennifer if any questions have come into the chat that we need to go over.
You did get a comment that was more of a, you might want to address as a clarification. It said that you mentioned that it's best just to send everything, but HIPAA requires them to send only the minimum necessary. So I didn't know if you wanted to touch upon that real quickly.
Sure. So this isn't a HIPAA non-compliance issue. Yes, we need the information for the date of service. However, information when it comes to skilled nursing facilities really entails a lot of look-back information. And it is not a HIPAA violation to send all documentation or the entire chart to satisfy all the different components of a skilled nursing facility review. So that's a really good question. But yes, in these cases, it is, it only behooves you to give us more documentation because it will help support and help us find all that look back information too. And then I see another question came in. Why does CMS include benefits exhaust claims in the 5-claim targeted probe and educate process. And benefit exhausts claims. While you're not getting any payment, you're still required to do the things that are required by Medicare when caring for your patients and submit that information so we can, review that and make sure. They really, I don't know why some of those come up more frequently than others. A lot of times we try to exclude those that are benefit exhaust because you're really not getting any information, but know that we can and we have and we are reviewing claims even if no money is being exchanged, because we have to make sure that you're in compliance with Medicare laws, rules, and regulations. That's a really good question. Thank you, Janet. Okay, and at this time, I am not seeing, I'm scrolling through the chat and I'm not seeing any additional questions, but Jennifer can stop me at the end if we have additional questions that come in that I need to address. But I'm going to continue on with some closing remarks at this time. So in a few minutes, you are going to get an email that is also your certificate of achievement. So don't delete that email without reading through it. This email is your proof of attendance. It has contact hours in it if you happen to need contact hours for continuing education. If you are only on via phone, unfortunately, you're not going to get this email. You can email us at wps.education.wpsic.com and just let us know you were on this webinar via phone, and I can send a certificate out to you. If you happen to come up with a follow-up question after today's event, you can always send those to us at that same email address that I just read, and it's also linked on your slide deck here. So if you click on this, it's automatically going to generate an email for you and put follow-up question in the subject line. And you need to send those to us within the next week. And again, if you just type in the email address, make sure you put SNF 5-claim sample in the subject line so we know what it's about. If your question is really specific to your claim, however, we can't answer those because we don't have access to the claims, and we definitely don't want you sending any PHI or PII over an email. We don't want anyone to get in trouble for that. And finally, at the start of the event, I let you know that you're going to get a survey, and Jennifer's going to place that survey link in the chat. Again, we value your opinion. We want to hear from you. We want to know how we did on this event. So the survey only takes a few minutes to complete it, so I encourage you to complete it now if you could. It's your opportunity also to tell us what additional education you would like in the future. Many of our educational events are really a direct result of what you tell us that you want. We want to bring you the information you want that's valuable to you, that's going to help you in your job. So utilize this survey and let us know. And finally, I'll look at the chat. I don't see any more questions. On behalf of Jennifer and myself, as well as all of Medical Review, we want to thank you for your participation in today's event. This concludes our webinar, and you can now disconnect.